Have you been trying to conceive for the last several years, but frustratingly, it's not going anywhere? You and your partner may be thinking of starting fertility testing, but when is the right time? How soon is too soon? In this video, learn more about when you might want to start considering fertility testing, how it works, what the results can tell you, and what some of your fertility treatment options are. So, what is fertility testing? In a nutshell, fertility testing can offer insight into why you're having trouble conceiving. There are different types of fertility tests. Maybe you've seen at home tests that you can use that will tell you if you're ovulating and which days you'll experience peak fertility. When you track ovulation, usually through basal body temperature, you can better time intercourse and increase your chances of conceiving. Another option is a fertility tracking panel. This quantifies progesterone and anti-Mullerian hormone or AMH levels to better understand your ovarian health. If you go into an office, a fertility specialist can tell you more about what's causing your difficulty conceiving. The fertility specialist will conduct a physical exam and likely a blood test. They'll also ask about the woman's menstrual cycle, sexual history, medical history, lifestyle habits such as smoking, drinking, etc., any prescription medications being taken, and more. Please note that at home tracking isn't a replacement for seeing a specialist. Depending on the information you provide a specialist with, they'll recommend the best kind of fertility testing for you. For female infertility, this could mean blood testing to check your hormone levels, especially follicle stimulating hormone or FSH, which could interfere with your menstrual cycle or egg supply. Ovarian reserve testing is another option. It combines blood testing with transvaginal ultrasound imaging to better assess how your ovaries are functioning and if you have a low ovarian reserve, meaning you're not producing enough eggs. This type of fertility testing usually only applies to individuals going through in vitro fertilization or IVF. Other fertility tests for women may include a pelvic ultrasound, hysteroscopy, and genetic testing. Male infertility can be explored via semen analysis, blood screening, genetic testing, ultrasound imaging, and urinalysis. Out of the various options, semen analysis is the most common. This helps the doctor assess sperm motility and count. So, when should you start fertility testing? When you start fertility testing depends on a few factors, including your age, the health of your reproductive system, the status of certain health concerns, and your family history, since fertility issues can be genetic. If you've been having unprotected intercourse for a year and haven't been able to conceive, you should see a fertility specialist. If you're 35 years of age or older, consider seeing a specialist after 6 months of unprotected sex, since fertility declines with age. In addition, if you've had issues with your menstrual cycle, like going longer than a month between periods or having no menstrual period, then you may need testing. Uterine fibroids and ovarian cysts might also contribute to infertility, but it depends on the type of cyst or fibroid. Often, these are harmless. Repeated miscarriages in your past are another reason to consider testing, as is a history of pelvic problems and endometriosis, a condition where uterine lining grows outside the uterus. Technically, it's never too late to start fertility testing, although do keep in mind that as females age, conceiving becomes more challenging and can come with more inherent risk. So, what happens after you get your results? It depends on the results you get. Your fertility specialist might recommend further testing, or they might suggest you start fertility treatments like IVF or IUI, intrauterine insemination, right away. There are also certain medications that can help. For example, some can stimulate ovulation. Fertility treatments for men can include medication, surgery to improve sperm count, and sperm retrieval procedures. These types of procedures can be beneficial if, for example, the male has difficulty ejaculating. Certain lifestyle changes may affect fertility, so you'll want to reconsider your daily habits. You should not smoke, and you should limit or eliminate drinking alcohol and caffeine. In addition, it's helpful to maintain a healthy weight. While you should still incorporate physical activity into your lifestyle, intense and prolonged exercise may contribute to fertility issues. Talk to your provider about what this might look like for you on a weekly basis. Remember that protecting your wellness isn't just improving fertility. It can also improve symptoms from other health conditions you're experiencing due to any medical conditions. We know how frustrating it can be to try and still have a hard time conceiving. Our bodies are so complex. Shedding light on unexplained infertility can be a maze, and even once you identify the problem, addressing it is a whole other thing. Rest assured that reproductive medicine has come a long way. There are many options available to you to address infertility. Hormone levels play a significant role in fertility, and a blood test is the only way to determine where you stand. eNational testing has more than 2,000 locations across the United States, and we can even accommodate same day appointments. Our fertility tracking panel requires a simple blood test, and the results are delivered to you via email within 4 to 10 business days. Should you have questions about your test results, you can follow up with a clinician afterward.